Module 3, Staff Empowerment. The Staff Empowerment module of this toolkit will discuss the importance of staff empowerment and strategies for implementing staff empowerment in your facility. The objectives are to cite staff empowerment concepts, discuss how staff empowerment contributes to a culture of resident safety leading to improved outcomes and quality of life, illustrate 3 ways to increase staff empowerment, and explain how to address and overcome challenges to staff empowerment. Empowerment is the belief that you have the control and competence needed to make decisions. An organization that provides its staff access to support, resources, information, and opportunities to learn and grow will have a positive effect on employee job satisfaction and the quality of care they provide. Access to support refers to feedback and guidance from supervisors, peers, and direct reports. Access to resources includes funds, supplies, and time required to meet project goals. Access to information refers to the availability of knowledge of the organization's values, goals, and policies, and staff's knowledge and expertise required to work effectively. Lastly, access to opportunity is the availability of challenges, rewards, and professional development opportunities to increase job-related knowledge and skills. Organizational factors that can affect staff empowerment are structures for advancement opportunities, awareness of employee contributions, access to resources, information, and support. Staff empowerment is both the process and the outcome that provides employees the ability to make effective, timely decisions. This includes providing the resources and culture that support decision-making. While staff empowerment starts from leadership, the team and staff will be ultimately responsible for keeping up the motivation, project momentum, and positive reinforcement for one another to sustain long-term efforts. Measuring worker empowerment can help managers identify and remove conditions in the organization that lead to powerlessness. Several instruments are available to measure staff empowerment in long-term care. Consider gathering baseline empowerment data before you begin to implement changes and again afterwards. The U.S. Department of Health and Human Services, the U.S. Department of Labor, and the Institute for the Future of Aging Services have developed a report listed here that provides many tools to measure your staff empowerment level. For example, the Psychological Empowerment Instrument was designed to measure 4 dimensions of empowerment: meaning, competence, self-determination, and impact. The tool has 12 questions which can be administered in 5 to 10 minutes. Sample questions include: how strongly do you agree or disagree with these statements? Number 1, I am confident about my ability to do my job. Number 2, I am self-assured about my capability to perform my work. And number 3, I have mastered the skills necessary for my job. Studies have found that nurses who feel more empowered have higher job satisfaction, are more committed to their employer, and are less likely to voluntarily quit. An empowered frontline staff in nursing homes has also been shown to have lower turnover and provide improved quality of care. This illustration shows a positive relationship between staff empowerment and resident quality of life. Staff empowerment leads to higher job satisfaction, resulting in lower turnover. This leads to happier staff, which increases resident satisfaction and perception of care. This is particularly true for frontline staff in nursing homes like the Certified Nursing Assistants, or CNAs, as they have the most contact with residents and are more able to quickly respond to resident needs and changes. When frontline staff can influence day-to-day resident care decisions, both staff and residents are more satisfied. All these factors together lead to higher quality of care. Empowerment of nursing staff in decision-making is more strongly related to increased service quality than empowerment of non-nursing staff. In nursing homes, it's particularly important for CNAs and other frontline caregivers to be empowered because they're resident advocates and can recognize and respond to resident needs in real time. Nursing home administrators may want to consider creating teams that include employees with similar job titles and responsibilities who make decisions and recommendations on aspects of their jobs. Through empowerment, teams see their position as meaningful, which can boost morale and job performance. Empowered staff have the following characteristics. They are curious, interested in improvement, and have knowledge of nursing home resources and infrastructure. Staff who are empowered are invested in the success of the facility and the safety of its residents. By nurturing this curiosity, staff will feel comfortable speaking up and suggesting changes and improvements. Administrators want to provide an environment in which staff are comfortable asking questions about their work and the reasons for certain procedures. Administrators should support staff interest in finding ways to do things better, because frontline staff are the people closest to bedside processes. They have the greatest insight as to how things can be improved and which solutions are most likely to work. The success rate of process improvement can be enhanced through the empowered staff, as their hands-on input increases the likelihood of buy-in and acceptance of the new process. An empowered staff will have a broad view of resources and infrastructure. They know what help to seek, when to seek it, and who to ask. To give an example of this view, ask yourself these questions. How do we get our drugs from the pharmacy? Is there something about this process that affects my ability to do my clinical work? How does this process affect my residents? How can it be improved? How does this improvement affect not just my residents, but all the residents in the facility? An empowered staff understands how to assess organizational processes on clinical practice and be actively involved in these assessments. Is actively involved in the evaluation of practice interventions at an individual and an organizational level, and is comfortable participating in both of these activities. Staff empowerment can be facilitated by starting with a leader sharing the vision of an empowered staff and creating teams of frontline staff. By building trust and confidence, leadership and staff will have improved communication and information sharing. When confident and empowered staff use their shared information to improve care, leaders should provide positive reinforcement. A just culture is one that allows teams to learn from mistakes in a safe environment. If one team member makes a mistake, it's viewed as an opportunity for the entire team to learn and improve the process or system. On the flip side, if you don't have a just culture, staff will not report when an error happens because they will fear punishment, and processes may not change, and the same mistakes will continue to happen. The following video shows an empowered team. See if you can identify the elements of staff empowerment.
None of us want to see patients getting infections, but how do we all work together to prevent HAIs?
I'm making this a priority and will support what's needed to make improvements. As a team, everyone has to do his or her part if we're going to prevent healthcare-associated infections.
I think that sounds great, but honestly, and I hope you don't mind me saying this, I'm not sure why I was invited to this meeting. I see staff here from the senior leadership team, the medical director, nursing, rehab, and housekeeping. I'm a CNA. Why was I asked to join the team? Do you really want me on this type of project?
Absolutely, Fiona. Your perspective and experience are important because when we make policies, you're the one who helps us implement them at the bedside. We definitely need your help to understand if staff can implement proposed changes or if barriers exist. In fact, to truly understand what happens at the bedside, we'd like to add a family member or resident to this team so we can better understand their perspective.
Okay, that makes sense. Thank you for including me. I like to make a difference where I can.
This is a safe place where everyone can speak up. We all need to support one another and feel like participants in this project with accountability for reducing these types of infections. Yes, Kira?
Like Fiona, I'm also uncertain about my role on the team. Can you help me understand what you need from me?
I'm also wondering how housekeeping can help.
Kira, we need your input on how we can meet residents' toileting needs without using indwelling catheters. We need your help to develop care plans that will maintain or restore a resident's ability to get out of bed and use the restroom without help.
I couldn't agree more. Your knowledge of residents' mobility is valuable here.
Also, your rehab team is frequently in and out of residents' rooms, so vigilance for infection control is critical. This applies to everyone: nursing, dietary, CNAs, or anyone who is interacting with our residents. In addition, Kira, your team may have to reposition urinary catheters when present to allow residents to participate in rehab. It's also important that the catheter and the drainage bag be kept below the bladder at all times and the tubing isn't obstructed.
I have some ideas for improving how nursing and PT can work together to optimize residents' mobility in getting to the bathroom. I'm in.
Stedman, you heard Helen say that C. diff spores can survive on surfaces for months.
Yes, and we've been doing our best to keep all surfaces clean and disinfected.
I know you have, and I appreciate what a challenge that can be. With Helen's help, let's review our environmental cleaning and disinfection strategy as a team to ensure that our process is the most effective. And Corey, we'll need you to help us educate residents and families, especially residents, on contact precautions.
And Stedman, I have some great resources and references we can review to identify proven disinfection methods to kill C. diff and resistant organisms.
Helen, can we work together too? I need your expertise on an education plan teaching residents and families about preventing infections.
And Craig, as staff development coordinator, will need you to work with Helen to develop staff education about infection prevention strategies we decide to implement.
Okay, and we can include this new content in the orientation curriculum.
Aaron, as activities coordinator, when residents are on contact precautions, it would be nice if we had appropriate activities for them too.
Sure, I have a few ideas. I think we're all starting to see how everyone plays a role in keeping residents from getting these types of infections.
No member of the facility staff should be left out of the quality improvement process. Each staff member provides a unique and valuable perspective which allows all aspects of resident safety to be considered. Hierarchies within teams should be eliminated, as it creates a system in which one person's input is more valuable than another's. Leaders assist teams in setting ground rules, making it safe to speak up and voice concerns at any level. It's important to value each perspective equally, particularly of staff members who may be skeptical about their input being taken seriously. Leaders should also provide access to resources for an empowered staff. This can include channels for advancement or growth in the organization, such as incentive or career ladder programs for employees, opportunities for staff to build their knowledge and skills, including staff training about best practices for safety and infection prevention, and allowing staff to participate in task forces or committees that influence decisions related to day-to-day care, such as redesign of facility and resident spaces, operations, or technology to help staff do their jobs more efficiently. Watch this video showing two colleagues discussing a resident issue.
Hi, Joni. Can I talk to you for a minute?
Sure, Sharon. What's going on?
Well, last week when I was taking care of Mr. Fredericks, I was trying to readjust him in his bed, and the tube connecting his catheter and the drainage bag became disconnected.
Oh, it did?
Yeah, it touched the floor for barely a second, and I just reattached it. But I just found out that he has a catheter-associated urinary tract infection, and now I feel responsible for it.
Sharon, I'm so sorry. Unfortunately, things like this happen. My friend Julie works at Amberley Point, or did until the same thing happened to her. When her nurse manager found out, she yelled at her in front of everyone. Worse, she was fired on the spot.
Really? Well, I hope that doesn't happen to me. What should I do?
Well, remember that staff meeting a couple of weeks ago where the director of nursing encouraged us to be open about things like this so we can learn from them and prevent them from happening in the future? I think talking to Thomas is the next step and the right thing to do.
You're right. I've got to talk to our nurse manager about this.
Let me know what happens. Good luck.
Encouraging two-way communication between management and staff is crucial. Most managers will say they wish employees would bring up issues and discuss solutions more often. Getting staff to give constructive feedback or raise issues can be challenging. It may take trial and error to have workable systems in place. Planning forums for regular two-way communication with staff can be useful. Many staff report that meetings with leadership are intimidating or that leaders do not welcome their comments. The environment often doesn't feel safe for employees to share concerns or even positive updates. They are unsure what management wants to hear and sometimes feel uncomfortable speaking in front of other staff. You may develop ideas of your own, but here are some suggestions. Management will need to create clear ways to solicit ideas, input, and requests for resources. For example, set the expectation that staff regularly share at staff meetings. They can take turns presenting concerns or celebrating successes. Encouraging staff to celebrate accomplishments can help avoid the perception of staff or unit meetings being complaint sessions. It's also important to create a process for staff to share concerns outside of these meetings, especially early on while teams are still building confidence and may not feel safe or comfortable speaking out loud. Secure lockboxes for anonymous suggestions can work if management pays careful consideration to the items submitted. Managers should consider all requests and input, being careful not to provide the answer to staff before considering all the options. Assure everyone that they bring different skills to the table, all of which are valued. Time should be provided to actively seek input from everyone at the table or on the team. In the following video, Sharon brings up a mistake with her nurse manager. Watch how Thomas encourages communication and information sharing.
Hi, Thomas. Do you have a few minutes to talk?
Sure, Sharon.
I need to tell you something.
Come in. Please sit down. What's up?
It's about Mr. Fredericks. He's been diagnosed with a catheter-associated UTI and he's on antibiotics.
Oh, I didn't know that.
Well, last week when I was repositioning him in his bed, the drainage tubing became disconnected from his catheter.
Oh, it did?
Yes, and the tubing briefly touched the floor. I noticed it immediately, scooped it up, and reconnected it.
Without replacing the drainage system?
Correct. It only touched the floor for an instant, but I realize now that even an instant is too long. And now he's been diagnosed with the catheter-associated UTI, and I feel terrible. I wanted to talk to you about this right away. I'm really sorry.
Sharon, I appreciate your honesty and willingness to talk with me. I know it wasn't easy to step forward and tell me about this.
Yes, thank you.
You're a great nurse. We've all made errors in judgment. The most important thing is that you're honest. We can all learn from this and move forward. So I'm going to ask you to come with me to talk to the director of nursing.
Oh, really? Do you think she'll be angry? That I'll lose my...
No, she won't. And you're not going to lose your job either. I can reassure you of that.
Thomas, I hear you say that it'll be okay, but I'm worried. You know as well as I do that people have gotten fired over this sort of thing. It was an honest mistake, which won't happen again. I'm sorry.
Sharon, please believe me. Again, I appreciate that you've come to talk with me. I know you're sorry and that you've learned some important lessons.
I certainly have.
I expect the director of nursing's reaction will be similar to mine. Let's schedule a time to talk to her together.
As staff demonstrate their empowerment, leaders should acknowledge the positive changes in staff behavior. Here are 2 things you can do to provide positive reinforcement to staff. Number 1, set a goal, and when that goal is reached, plan a pizza party. Celebrating when goals are met is crucial to keeping momentum and engagement in the project. Leaders should be invited to these celebrations as they can learn about project success, and staff members have the chance to share their contributions. Number 2, discuss project successes with higher levels in the organization. Invite staff members who presented during all staff or unit meetings to share their stories with senior leaders and administrators. Recognize that there will often be failures in addition to successes. Encourage staff to find the silver linings or the pearls of wisdom in these failures. In failure, you're given an opportunity to learn from your mistakes and continue to improve processes. By using the Learn from Defects tool, teams can get down to the root cause of the problem, allowing for more targeted improvement. In the following video, Sharon and Thomas speak with the Director of Nursing about Sharon's mistake and protocol.
Sharon and Thomas, thanks for coming. Please, have a seat.
I'm a nervous wreck. Am I in big trouble?
Sharon, please sit. We're going to talk about this. You aren't in trouble. I really appreciate you coming forward. We need all of our staff members to do the same when a mistake happens. We can all learn from our errors and make this a safer home for our residents.
Okay.
Thank you both again for being here. Let me explain to you why I'm glad Thomas reached out to me yesterday and explained the situation. Healthcare-associated infections, or HAIs, in the long-term care setting are a big problem. We know the residents living here are susceptible to infection and can even die from one. It's important to have open communication when something happens in our practice that can lead to an infection.
Well, yes, I agree.
We know that Mr. Fredericks has a catheter-associated UTI. And as I understand it from Thomas, there was a breach in the protocol that we use when taking care of patients with urinary catheters. Is that right?
Well, yes, there was. And I'm so sorry. To think that I caused Mr. Fredericks additional
Sharon,
pain.
I can see that you're upset about this and want to prevent HAIs from happening in the future.
Well, absolutely, I do.
That's exactly why we're here.
We're trying to create an environment of a just culture. By that we mean that we recognize that people make mistakes. And when that happens, it's not usually intentional. It's often because we forget things or get distracted, especially when it's really busy and we're trying to get a number of tasks done at the same time. Or it happens because we don't recognize the risk that can result from our actions. And to be honest, many times it's a systems problem, right, Thomas?
Yes, like when we can't get medicines from the pharmacy on time or when devices are defective. All types of situations make it easy for us to make an error or make a decision that could put a resident at risk.
By talking about it, we make the system safer. Sharon, can you please walk us through what actually happened with Mr. Fredericks?
Yes, I was positioning Mr. Fredericks in his bed when...
Sharon's mistake is used as an opportunity to learn, and Sharon is encouraged to bring forward such mistakes that allow the facility to re-examine their procedure and the reason for the mistake. Teams should develop a strong sense of collaborative trust and confidence. This trust and confidence can be described as psychological safety, where team members feel safe interacting with the group. Team members who promote psychological safety will invite input from all team members, encourage team members to contribute, promote active listening and learning from each other, ensure all team members are accessible, and acknowledge the limits of current knowledge. Confidence is the essential element that will allow staff to feel empowered in the work they're doing. Staff members who feel confident in their work, knowledge, and skills are more satisfied with their jobs. In the following video, Sharon and Thomas speak again with the Director of Nursing about Sharon's mistake and protocol.
Thank you for explaining that, Sharon. Now, let me repeat back to you what I heard to make sure that I clearly understood everything. You were positioning Mr. Fredericks in his bed. The drainage tubing became disconnected from the catheter. You recognized it right away. When you saw it hit the floor, you picked it up immediately and reconnected it. Is that right?
Yes, that's what I did.
You said that it just touched the floor briefly, and you didn't think it would be a problem if you reconnected it. Is that correct?
Yes. If I had known that Mr. Fredericks would get an infection, I never would have done that.
Well, we're not sure that this situation caused the infection. However, we want to do everything we can to reduce HAIs. So Sharon, is there anything you would do differently the next time?
Well, for sure. I'll never reconnect a drainage tubing to a catheter if it becomes disconnected and touches the floor. I know it'll take a few extra minutes to grab a new drainage kit, but it's worth it if it prevents an infection for a resident.
That's good to hear, Sharon. I admire your courage in coming forward. Hearing you explain why you made the choices you made will enable us to develop ways to help the rest of the staff reduce risk in the future.
The term just culture refers to a system of shared accountability in which healthcare organizations are accountable for the practices they've designed and for sustaining the safe choices they've made. Staff in turn are accountable for the choices they make to ensure their residents receive the highest quality of care possible. A just culture environment helps provide a foundation for staff empowerment. Within the just culture model, 5 key elements contribute to improved outcomes. Mission, values, and expectations. For an organization to be effective, it must first define its mission and articulate values and expectations that align with that mission. Perfection is not a productive expectation because it's unattainable. Rather, an organization should set improvement as a goal. Defining these expectations gives staff a clear understanding of how they fit into the organization and how they can contribute. System design. Humans are not perfect and occasionally make mistakes, either through unintentional errors or risky behaviors. To achieve optimal outcomes, organizations must design systems that minimize risks. Forcing functions, checks, and redundancies are some features of systems intended to minimize errors. Creating a culture in which staff feels safe discussing errors and concerns will allow an organization to learn from these mistakes and refine systems to be safer in the future. Open communication and the ability to provide meaningful feedback are key elements for an empowered staff. Behavioral choices. Managing human behavior is essential to achieving outcomes. It's important to reinforce behaviors that reduce risk and deter behaviors that increase risk. Learning systems. By establishing learning systems, organizations can manage both systems and human behavior. The Staff Safety Assessment and Learn From Defects form in this toolkit are 2 communication tools that can be used to promote learning systems. Learning opportunities, including the development of skills, techniques, and career development, will allow staff to feel more prepared and committed to their work. Accountability and justice. Accountability in a just culture is about more than simply blaming a person whenever a resident is harmed. In a just culture, the quality of behavioral choices should be emphasized more than the outcome of the choices, which may or may not have resulted in harm. A non-punitive response to error is important. All humans make mistakes, and it's important to differentiate between human error and at-risk behavior versus reckless behavior. A system of just culture recognizes that people make mistakes. Sharon was able to bring her mistake to the nurse manager and the director of nursing, who recognized that this mistake was an opportunity to learn and not an intentional harm on Sharon's part.
I admire your courage in coming forward. Hearing you explain why you made the choices you made will enable us to develop ways to help the rest of the staff reduce risk in the future.
Well, thank you so much for saying that. I'm grateful for the way this whole situation's been handled. It's a lot different from what others have experienced.
Oh? How was that?
I heard about a nurse at another facility who made a similar mistake, and the response wasn't like this at all. The nurse manager yelled at her in front of everyone and fired her on the spot. Thank you for taking the time to talk with us privately.
Mariana, I appreciate your approach as well. It makes such a difference that our leaders want to have a culture of safety in which it's safe to talk about errors. Sharon, we're really glad you spoke up. Our intent is to support team members who ask for help because that's how we learn. Nobody wants to talk about the mistakes they make, but if we can create a safe environment for talking, we all can figure out a way to prevent similar mistakes in the future.
Well, thanks for saying that. But I do understand why people are reluctant to come forward. When you make a mistake and a patient gets sick, you feel awful. I'm grateful to be part of a work environment like this one.
I know it's not always easy to speak up. That's why next week we're going to participate in a Team Steps course. Team Steps teaches communication tools we can use to raise concerns if we see something that is not right. I think it will be great if you both attended.
Absolutely. I'll check the schedules.
Thomas, thank you. I'm looking forward to being there.
Many barriers to staff empowerment need to be acknowledged and addressed based on your own facility experience. Lack of resources, poor teamwork, and high staff turnover are just a few examples you might experience in your facility. Team leaders must both change the systems that undermine the team's vision and also remove obstacles to change. It's essential that team leaders remove as many barriers as possible. Some key ways to engage your senior leader include communicating data, obtaining consensus on the shared vision, and aligning project goals with the facility goals. For more details and strategies, refer to the Senior Leader Engagement module of this Long-Term Care Safety Toolkit. Empowerment of frontline staff contributes to lower staff turnover and higher job satisfaction, which then increases resident satisfaction and resident safety. The key factors in empowering staff include opportunities for growth, resources, information, support, and acknowledgement of staff contributions.